New at 11, COVID-19 is fading away in most parts of the state, but as health restrictions loosen, pediatricians' offices are beginning to fill up. KPIX5's Andria Borba spoke to Bay Area doctors tonight about what they're seeing and why. Andria?
Well, Elizabeth, all those measures that kept all of us safe during the height of the pandemic also kept some childhood illnesses in check, and those are making a surprise summer comeback. All of that social distancing, hand washing, and masking not only slowed down the prevalence of COVID-19 in kids, but also slowed down other childhood illnesses. Just ask mother of 13-month-old identical twins Jackson and Maddox.
They did get their first fever a couple months back, and I know normally that would have happened a lot earlier.
While the flus, rhinovirus, and RSVs that are the hallmark of childhood winter petered out during the pandemic, they're making a most unusual summertime return. Dr. Alan Schroeder is a pediatric critical care physician at Stanford.
We saw nothing over the course of the winter. Normally by now, RSV would have gone away, but instead, because of the effects of the pandemic, we're now just starting to see an uptick.
Nadim Hossan's kids, Liam and Stella, had an illness-free winter too, but he wonders at what cost.
Yeah, they were healthy. Yeah, I mean, obviously stuck indoors, in the schools were not cooperating, obviously, so it was hard on them, I think, just to be stuck. But yeah, health-wise, it was great.
Anderson says she does look at playground interaction differently now.
I think I'm more aware when kids are touching each other.
Dr. Schroeder hopes that the pandemic has changed attitudes about illness, and that might translate to fewer viruses of all stripes spreading in the future.
And I think probably people are going to be better about not sending their kids to daycare and school when they're sick.
Andria, what are doctors saying about children returning to school and daycare both this summer and in the fall?
They say absolutely send your children back. It will be safe for them to go back. These are the illnesses they were going to run into and need